Hi, everybody. Brianna here with another installment of our Insider Perspective interview series. Here at Nurse Tech, we give nurses a place to belong to, a platform to be heard, the breathing room to be accepted right where we are today. Nurse Tech is built on our collective voice as nurses, and today we're proud to add the voice of Anna Moats-Gibson. Anna currently works as a nursing instructor at Des Moines Area Community College and also as a postpartum nurse. In addition, she is passionate about a wide variety of topics that I can't wait to see how you got into all of these different things, including healthcare marketing, breathwork, and virtual reality. So Anna, thank you for joining us today. We appreciate you giving us your time.
Yeah, thank you for having me. This is a wonderful platform to just be included in. So thank you very much.
Awesome. Tell us, let's start from the beginning. Tell us what got you started in nursing and what continues your passion there.
Yeah, so I began as a student, well, not a student, just a nursing aide when I was in high school, and it obviously grew from there. I love taking care of patients, and my main focus for anything is education and empowerment. And nursing is a very good place to be able to share those passions. So I graduated and immediately went into postpartum nursing. And just that's where my heart is, because I get to teach moms and dads how to take care of their babies, and things change every day. And I enjoy learning the best modalities of ways of teaching the patients, as well as staff and my coworkers. So.
Well, I know for every nurse that is also a mom, being on the opposite side, especially like first-time moms that are also nurses, I just remember that almost being like an out-of-body experience. Not only are you going through this like such a huge life change, but you're also like your nursing hat is kind of on in the background. And I just feel like all of the postpartum nurses I've ever had are like angels. They just have such a great niche that they're in. And so I appreciate the work that you do. Because it is, you have a lot of patients besides just the mom, just the dad, just the baby. It's like a collective unit. So that's great. And it's so unusual that you've stayed in the same field for so, like for nurses, most are like, I did a little of this and then I moved here. But that's really cool that you've stuck with the postpartum this whole time. You found your groove.
Absolutely, yes.
Tell us about your passions in nursing, and what keeps you motivated, and the current climate that we're in, that, everybody's under such stress in the nursing world.
Yeah, so I'm really passionate about empowering the patient themselves. So, it's one thing to take care of the patient and make sure that they're well enough to go home, but it's another thing to help them thrive when they're at home.
Yeah.
And I can only do so much, but while they're in the hospital, my focus is to get them better and to help them have the best setup when they go home.
Right.
So just again, education is one of the main things that I focus on, and giving them as many resources that they need to help. So.
Exactly. I feel like that was a big message. Like, you're probably not going to remember all that I'm telling you. There are the 8 other places where you can also find it. You are stuck at 2 a.m. feeling very alone. You work as a current nursing instructor. Tell us a little bit about some of the challenges you went through as a result of the pandemic.
Yeah, this could last all day, actually, but I'll try to condense it down. I would say the main thing is the clinical setting. And obviously everyone kind of knows basically all of the clinicals had to be like converted to virtual clinicals when the pandemic started. And that was really difficult on staff because they had to figure out how to run a virtual clinical, hard on
Right.
students because they don't get their
Yeah.
hands-on experience, and then actually hard on the students that were going through the clinicals. It's hard on them now because they're finally graduated and they're getting into the
Mhm.
nursing profession and may need a little bit more support than what they would have if they were
Right.
in clinicals. So we have to keep all of those things in mind. And I think the whole healthcare profession is actually doing a really good job trying to just support that
Right.
system and just trying to make things work and trying to new things all the time
Right.
to support that. So
Yeah.
um, yeah, I also saw a lot of exhaustion in staff. Even now, when we're
Right.
back in clinicals, it's exhaustion and trying to teach a new student things when they're so short staffed.
Right.
It's a hard balance for
Yeah.
sure. So
Right. It's like a
mhm.
steep learning curve for everybody in that sense of converting learning models over to simulation and then still being able to pep talk the students like you could actually do this on a real person too, But
Absolutely.
there's that intimidation factor that you kind of get over when you're a student, like just walking into a patient's room as a nurse, in that role. So that's a hard thing to miss out on in school, and have to learn like on the fly. But
Yes.
I give the students so much credit right now. Because yeah, I can tell that it's a lot for them, and I'm glad you mentioned the instructors too, because
Mhm.
everybody feels the strain of it for sure.
Yeah.
Um, Talk to us about a major innovation or invention or modality shift, as you were mentioning, that's helped support the quality of nursing education. I know you have your hand in the virtual reality world, which we'll get into more. But any innovative ideas or things that we should be knowing about or prospective students that has changed lately?
Yeah, I think just the force in change that had to happen with COVID, moving to the online space. There's some really, really cool simulation
Yeah.
experiences that are online. So I would say that's the main thing that we actually were kind of forced to use. And
Right.
thank goodness we were, because now it's just going to be included in nursing education.
Yeah.
Yeah, and you mentioned virtual reality, and that's kind of where education is going.
Yeah.
Um, it's something where you actually put on a headset and you're just immersed in the experience. It's not
Yeah.
even like education, it's literally experiencing what you're going to
Right.
experience on the floor as a
Right.
nurse. So,
That's so
there's of
cool.
course some barriers, but it's the um, most safe way
Yeah.
that nursing students can learn. They
Right.
can make mistakes and learn from it and debrief and have this like tactile and like experience that your brain doesn't really know
Right.
is like pretend, you know? It's
Yeah.
it's it's a huge um I would say the most innovative way that we can change nursing
Right.
education. And it's actually not a new way. It's not a new idea. It's been here for a while. It's
Yeah.
just trying to um, maneuver it into nursing
Right.
education the correct way. And
Right.
there's going to be some bumps along the way, but just giving it a try and
Mhm.
learning from the mistakes or the changes that we need to make
Right.
it, the most effective for nurses and
Yeah.
students. I mentioned the nurses because we can use that in healthcare education in
Right.
general. So it's not just nursing nursing students. It can be used in, learning new skills at the hospital or
Right.
improving your education. So
Yeah, very
Mhm.
cool. I mean, I'm like thinking back to when I was in nursing school and the simulation models, like the instructor would have her booklet reading from, and like they might throw you a couple of curveballs, like, oh, the blood pressure just dropped. Now what are you going to do? But I can imagine you're able to develop way more critical thinking skills based on like little things that pop up in a virtual reality format versus like your instructor and all your classmates watching you and like that's just what I'm remembering. Can you walk us through like one of the simulations, like you set and you're like, are you in like a patient room, or how is it actually like going through it as a student for the first time?
Yeah, so I mean, the possibilities are endless. So,
Yeah.
when you're just starting out in virtual reality, though, you kind of have to keep in mind that you're gonna get kind of a little bit sick, like
Yeah, right.
um, just you're not used to that kind of walking into the virtual reality space. So we do start out. Um, they can start out in a classroom, just sitting down and actually
Mhm.
just watching a lecture even, and then
Right.
maybe you're talking about cardiology, then you actually are speaking about specific parts of the heart. So then your instructor takes you actually inside the heart and you're
Yeah,
in that
like the
structure
magic
of the
school
heart.
bus.
Yeah, yeah. So it's totally, I mean, you can look at it on a book, a picture of a heart in the book,
Right.
but to be actually standing in the middle of a heart is like a totally
Yeah,
different experience.
that's so
So there's
cool.
that. Yeah, yeah. So there's that one specific piece of just like of just the lecturing, but then you also have the part of the simulations. So yeah, the
Mhm.
instructor can pretty much craft any type of simulation, and you may need to start an IV. So you
Mhm.
literally use your little hand pieces and you
Yep.
start the IV and you feel the
Yeah.
vibration of, if you got in the vein through your
Right.
handpiece. Um,
Amazing. I
yeah,
wasn't
yeah.
even thinking of like a classroom situation. I'm like only thinking, I guess, simulation models, running through role playing stuff. But so you're talking about like you put the headset on your entire lecture. There's like an avatar teacher at the front, and all, like from start to finish, you're in a virtual reality mode.
Yes.
That's so
Yes.
cool. Oh my
Yeah.
gosh. So people could do this at home if they have the
Yes, and
headset.
you can have a student sitting right next to you from across the world. Yeah.
Oh my God, that is so cool. Wow. Yeah.
Mhm.
Do you feel like, how can I say this without being ageist? Instructors, was it hard for the instructors to acclimate to using these different technology tools that are available?
That's the barrier that we're coming against right now. Yes.
Right. Like I feel like my 15-month-old knows how to do things on my phone. And like we don't even really give him, like if he gets a hold of it, he's already like gotten into 3 different apps. And I'm like, it's just their brains from such an earlier age are just like their fingers that have this muscle memory of how to do all this stuff that is a struggle for people that didn't learn nursing that way themselves.
Yes. Yes.
Yeah, I can imagine that would be a tricky thing to navigate through.
Mhm.
um let's talk a little bit about current working conditions for nurses. I love that you like have one foot in the real world of bedside care still, and then
Mhm.
also teaching our nurses that are coming in. Um, how have the working conditions been for you? What do you think about, just the evolution of the pandemic and the changing opinion of society on nursing and how that's impacted the care that we deliver? I'd love to hear your thoughts on that.
Yeah, so I mean, it's not a secret that we are short-staffed, but a lot of us nurses want to give our patients the time that
Yeah,
they deserve. And that's where it's a very big challenge for us because we care to give the best care to every
exactly.
single patient.
That's
And
exactly
when
it.
we are short staffed, it's difficult to do that, but we
Right.
don't want to show it.
Right.
And that's where I think the exhaustion even
Yeah.
heightens
Yes.
because we don't want to show that to our patients. And we try the hardest we can try, to give each person individualized care.
Yes. Exactly.
So, Yeah. And so I think that, society has always trusted nurses.
Right.
But I think they are respecting us more now. And
Yeah.
that is us as a nurse, we need to take that as kind of like a boost. Like,
Yeah.
what can we do now?
Right.
Nurses are being respected. And so now's our time. Now's
Right.
our time to influence the
Yeah.
healthcare
Yeah.
community and to influence society.
Yeah. I couldn't agree more. And I think more and more nurses, like with the help of being so connected on social media and different news channels, like you can't hardly find a nurse right now that doesn't understand that concept and feels, I think, the change coming.
Hmm.
But it's, change is uncomfortable. So there's there's that whole aspect of it too that is
Yes.
coming off of a pandemic, like you said, where there's profound exhaustion, and then being like, one more thing we need help with, overhauling a
Hmm.
healthcare system real quick, and then we'll be
Yep.
done. Then we can all take a big breath of air, which is segueing into my next question for you. It's about breath work. I think you being a postpartum nurse, a lot of people probably equate that with like Lamaze, or maybe even if they've done some yoga. But I know it's its own genre. So I'd love to hear more about that and how you use that to help nurses.
Yeah, so breath work is a healing modality that we all have access to. I mean, breath has brought us to where we are today. It's so natural. Our brain doesn't have to think about breathing, it's just
Yeah.
something that happens in our body. But when we take that breath and actually focus on it,
Mhm.
there's a whole new meaning. It's a it's a kind of an out of body experience, actually, that actually takes you deeper inside your body, and you
Mhm.
actually can heal the cells of your body. Your
Amazing.
Every single cell of your body needs oxygen, and if you focus your attention on sending that oxygen to your cells, you're going to switch the stress hormone.
Yeah.
So a lot of times so as nurses, as healthcare professionals, we are in such heightened stress right now that we're in this fight or flight response most of the time when we're at
Mhm.
work, and we bring it home with us too.
Mhm.
So how can we switch that and go back into our calm,
Mhm.
reflective state of mind? Because when we're there, we can think more clearly,
Yeah.
we make better choices, and we take better care of ourselves.
Right.
And that just switches our whole frame of mind.
Yeah.
So,
Absolutely.
breath work really can help calm the nervous system and get back into that calm state of mind.
Yeah.
It's just within 2-3 minutes. That's all you need. It's
Yeah.
it's what you have that tool any moment that
Right.
you
You
need
don't
it.
need like a yoga mat or a heated sauna. Yeah. I love that. So
Yes.
like driving home from work, you can feel you're idling high still from the million and one things that are weighing your mind down. And so you can, like you're saying, is there like apps that walk you through it if you're new to it? Like how, so if someone listening to this is like, that sounds like exactly what I need. How do I do this? Who can teach me? Can they find you? Or are there people that can walk them through how to get started on it?
Absolutely. So, first thing I'd recommend is just finding a song, like listening when you're listening to the radio on in the car ride home, or even on the way to work.
Hmm.
When you're listening to a song, you figure out, okay, this is the one song that I'm going to breathe to.
Okay.
And you breathe through your nose and out your mouth, and just
Hmm.
keep going through your nose, out your mouth, and kind of, you could go with the rhythm, you could go slower, you could go faster, whatever you feel. I wouldn't go like super fast while you're
Right.
driving by any means, but
Hyperventilating.
but just paying attention to your breath.
Yeah.
Or just
Interesting.
when you park your car and before you go into work, listen to one song and just breathe to it. Give it
Yeah.
a try.
That's
But
amazing.
I work with nurses to help them calm their nervous systems.
Hmm.
I am beginning to start with some group sessions, group breathwork sessions. So if anyone's interested in that, we can
Awesome.
definitely,
Yep.
get in contact with me and we can chat about that. But yeah, we'll do group sessions every couple days to just
Yep.
help get your nervous system back into that calm state. So
And I love that it's like a tool you can bring with you. So instead of like running to the med room to cry, you can run to the med room and, do 2 or 3 minutes of breath work and like literally calm yourself down
yes,
and be ready to face the next thing without carrying in the 5 bags that you're already carrying around, mentally speaking.
yes.
Yeah, that's great. I love that aspect of it, that it's like always with you. You just need
Hmm.
to tap into it. Um, Nurses that are burnt out right now, that are considering leaving the profession, the ones that I think are we're trained to be like, just go back to school, just get some more letters after your name, move on to the next thing. But we need bedside nurses more than ever right now, which I think are the ones that are under the most stress. Do you have any messages to keep morale up if you're feeling like you're Googling other career options every night, or, you feel like you're headed out the door?
Yeah. So, first of all, you need to care for yourself, and that's hard.
Hmm.
It's hard when we're trying to give the best care to every single patient.
Yeah.
So, just taking a couple minutes, like say you need to just sit down and chart, you haven't charted all shift, but maybe your mind is running so fast, like you can't focus on what actually you need to chart.
Right.
So instead, take 2 minutes and go get a bite of food and then do 30 minutes of breath work
Hmm.
and then come back and chart. I guarantee that your mind is going to have a little bit more clarity and you're actually going to be more efficient on
Yeah,
charting. So
exactly. I know.
that's number one, is taking care of yourself. And that doesn't mean you have to take it like a bubble bath every night
Right.
after work. You just
Yeah.
have to find those little tiny things that you can do as you're working to continue to keep your morale up. So
Yeah.
that's number one. I would also say you need to give yourself grace. We're all going through a very, very hard time. So it's okay if you're not the most cheery, happy person
Right.
that your patients are around today. Maybe you can't be that person,
Right.
but what you are there to do is your job, and you know the best way to do that. So just
Yeah.
give yourself grace and give your coworkers grace, because
Yeah.
everyone's going through this.
Yeah. I love that message. That's so important. Do you feel like nurses are taking self-care more seriously now than we did 5 years or 10 years ago?
I think it's spoken a lot more, but I don't know if it's
Mm,
practiced enough.
yeah. Right.
So that's the
Even like
next step.
looking at it like something that's a job requirement,
Mhm.
like we need to make sure everybody gets their meds on time and, charted in a reasonable amount of time. And also I was having a conversation with someone a couple weeks back, and she's like, I'd love to see institutions, instead of like putting it as one more thing nurses have to do, another box to tick, it would be nice to see a paradigm shift where organizations are like, you have a mandatory 20 minutes of breath work, or something, whatever works for you to recenter yourself, and working that into the culture. And I was like, just because we always put it back on the nurse themselves, like fit this in, on your commute, or like between your kids' baths that night or whatever.
Mhm.
And I was like, gosh, I never thought about having it be a shared responsibility, like within the community that you're in, versus just another responsibility you need to do for yourself.
Yeah,
Yeah.
yeah, I think about that often. Like, there's a requirement to have a pumping room for,
Right.
for
Exactly.
lactation. How
Yeah.
about the requirement of like a meditation room?
I know. I mean, it really, like,
Yeah.
this is the prime opportunity, I think, for us to really advocate for it.
Mhm.
But, as you know, when nurses have a hard time, we put ourselves last, like by default. So being able to break out of that mold is, I don't know, I feel like this is the time we have to be able to maybe do that.
Yes, and that's one of my goals too, is to educate the healthcare industry about like how you can actually keep your nurses, like
Yeah,
putting them first and giving them a tool that's
right,
always in their toolbox.
right,
So yeah, the more tools that we can give to the staff nurses, the more we're going to be able to keep them.
right.
So
Exactly.
yeah.
I know you mentioned education as something that you love about being a postpartum nurse. And we all hear the saying, like, it takes a village to raise a kid. Like, here's all the resources that are available to you. Like, you're not meant to do this alone, figuratively or literally. Um, and that sense of community, we're huge on community at Nurse Tech too. We feel like nursing is not something you should feel alone doing. What are your thoughts on community, ones that you've belonged to, or like the nursing student community, and how that can help nurses, especially now?
Yeah, I think it's more important now than ever before to have just that support and um, the camaraderie and just the understanding that we're all going through the same thing.
Yeah.
Um, and regardless of kind of like where we're at in the industry, like whether we're a home care nurse or a postpartum nurse or, a nursing instructor, like we're all going through this.
Hmm.
So let's, instead of just trying to get through it on our own, like let's lift each other up and share our experiences
Hmm.
so that we can all collaborate and have bigger and better ideas,
Yeah.
and we can make a bigger impact.
Right.
So absolutely, Nurse Tech is amazing for that.
Yeah. Thank you.
Mm-hmm.
One thing we haven't talked about that I'm like so super curious about. I love learning how like different paths of curiosity lead to like new careers in some cases, or side hustles, or whatever you want to call them. I know you dabble in healthcare marketing. Can you tell
Yes.
us how you got interested in that? Like how you learned about it? I think nurses now, we realize the many opportunities that are available to us, but I think
Mm-hmm.
jumping from like thinking about it to actually like doing it practically or in real time, like that's the missing link a lot of the time. So can you walk us through how that happened for you?
Yeah, it's good timing you asked that right now, because basically I was burnt out from nursing.
Yeah.
So I wanted to leave the nursing profession. I wanted to find something that I could do from home with my
Right.
kids. And I always loved writing. So I began writing some nursing, like little educational pieces for different companies,
Hmm.
and I enjoyed doing that. And then I thought, well, I might as well like have a business. So I learned some marketing tactics, and um, so I opened my business, but it felt like I couldn't find the right client for some reason or another, and
Hmm.
it took a lot of time away from my family, actually, which is what a business does to begin
Hmm.
with. I guess any business
Absolutely.
does that. Um, but I actually then I found breathwork. So through like
Wow.
working with my marketing business, I was like, okay, I've got to take care of myself if I want my business to thrive. And that's
Yeah.
where I found breathwork.
How
I was
fun.
actually in just like a coaching clinic type
Yep.
situation, and there was a breakout session, and it was breathwork. And
Yeah.
I literally did 15 minutes of breathwork, and then I had to go to work that night. And my whole mindset for nursing just switched. I was like, oh my
Wow.
gosh, like I feel so much lighter. I'm like happy to go to work. I'm like
Yeah.
having fun talking with my coworkers. Like, what
Right.
is this?
Right.
And that's
What did I
that's
do
where it's like
differently?
breath work is it.
Wow.
Like we have to do this so that we
Amazing.
can, enjoy
Right.
why we actually went into nursing in the first place.
Right. And to fit it in to our daily schedules that, we're already so jam-packed with things.
Hmm.
That's what I know I keep saying this over and over, but that's why I love it so accessible, because you think like
Yes.
I got to get a therapist, which means I got to go like find one. And then they're probably going to have a wait list. And it's like you plan to do the mental health, self-care, wellness work, but it's requires effort to get there sometimes, versus
Yes.
this, which is like, you could be doing this tonight, you know? I love
Yeah,
that.
absolutely.
And I love how like following, you said you were looking into the marketing thing, like just staying open and being curious and following things that interest you. You don't know where they're going to lead you. And with nursing, like you can insert your nursing knowledge into so many different places.
Hmm.
That's one of the greatest things about the profession. And we talk to a lot of different people that have followed their own little path, to all these great little spots. And I just hope that the nurses out there that are watching and listening, like you don't have to know what you're going to arrive at to begin. You can just start somewhere, and you really don't know where it's going to take you.
Yes, yes. My word for 2022 is surrender. And
I love
just surrendering to anything that's possible.
it. Yeah.
Who knows what it's going to be,
Right.
So it's
Yeah.
just letting things come and really listening to your body. And what does your body feel like
Yeah.
when you have this thought come in?
Yes.
If it feels icky, maybe it's not for you, and that's
Right.
okay.
Yes.
But maybe there's some other thought or some other like little someone kind of gives you an idea and you're like, I never thought about that, but what does my body actually feel like when I think
Right.
about it? Like, yeah, it actually feels kind of good.
Right.
Like, so listening to what your heart tells you
Hmm.
is is a hard thing for us nurses to do,
Right.
because we've been so trained in the structured mind.
Yes.
Like, what diagnosis does my patient
Right.
have? Like, what interventions do I need to do? Boom, 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 like
Yep.
all of these connecting parts
Hmm.
in our structured mind as a nurse.
Hmm.
But actually, like, what can we do as a person in
Yes.
our bodies, and
Right.
how can we feel
Right.
that decision being made?
Yeah. I think that I love everything you just said. And it reminds me of like, there's a moment I think that happens for all nurses, like in school, clinicals, wherever, where you realize as much knowledge you can stuff into your brain, even like the most brilliant nurses that are out there. If you ask any one of them, like, what's the potential for like the healing power of touch when you just put an arm on a patient, every nurse is going
Mhm.
to have that expression you just had. It's like, yes, we know this. But
Yes.
then using that knowing and turning it around on ourselves, that we hold so much emotional trauma in our bodies, and we can, like you said, listen to them.
Mhm.
Um, and I love that your word is surrender, because I feel like the last 3 years we've just been, every sentence starts out in these uncertain times, but
Yes.
harnessing uncertainty for the lighter aspect of it, like, just brings a levity to it that I think we need. We can like take back uncertainty as not such a dark, dismal thing. Um,
Yeah.
and
Yeah.
use it
It's
as
a
a
good
place to
time for
grow.
change.
Yes, exactly. I love that.
Mhm.
Well, tell us, is there anything else you wanted to highlight on? I feel like we covered some great areas. We'll definitely let interested nurses know how they can find you and learn more about the work that you do. But we always like to tell people if there's a message that they want to give to nurses at the end of our talk, or anything that we didn't mention. We like to give the floor over to you for a couple of minutes if you'd like to leave us with any thoughts.
Yeah, I would say we touched on most of it, but the main thing is I just want to thank all of the nurses and healthcare professionals who have worked their butts off during these times. And you know, it's a lot, and every single person has trauma because of it.
Yeah.
And even before that, we all have trauma. So how can we not push it away, but integrate it and
Yeah.
learn from it and accept what we just went through and accept everything that we're going through? Every shift, like every
Right.
shift, there's a challenge. So instead of getting frustrated or angry or closed down, how can we actually just integrate that and learn from it
Mhm.
and feel it.
Yeah.
That's the main thing, is instead of blocking it off, building a whole big shield and
Right.
armor around us,
Yeah.
let's stop and like feel it and like
Mhm.
let our body just understand what we just went through.
Right.
And with that, then we can move forward.
Yeah. I love that. Nurses are a resilient bunch, and I love the idea of like that's our superpower, you know? So
Yes.
awesome. Well, thank you so much, Anna. This has been such a great conversation.